Good morning, everybody. My name is Antonius Christy Copat Mojo. Uh, come from Faculty of Medicine, Universitas Plus Maret, Surakarta, Indonesia. Today, I would like to present my presentations about 90-year-old women with HIV stage 4 associated opportunistic infections of cerebral toxoplasmosis, wasting syndrome, and oral thrush and normocytic normochromic anemia. Slides. The first, the introductions. The Toxoplasmosis gondii is one of the most common infectious parasites distributed worldwide, affecting around one third of the global population. Toxoplasmosis is a relatively mild disease in immunocompetent people, but it can be severe in life-threatening in immunocompromised patients, especially in developing countries. The cerebral toxoplasmosis remains the most common cause of expansive brain lesions in people living with HIV or AIDS. Here are these case illustrations. A 90-year-old woman patients had been admitted to Mowadi Hospital emergency room with chief complaint of unconsciousness. She had history of headache, fatigue, weakness, weight loss, myalgia, and oral thrush without history of vomiting, paralysis, seizures, hair loss, fever, cough, or shortness of breath. She had neurological impairment and magnetic resonance imaging of brain showed an irregular ring enhancement with eccentric target signs were positive for cerebral toxoplasmosis. Immunological and biological studies show HIV reactive. Toxo IgG is positive and low CD4 counts is 11 cells per microliter and low hemoglobin 9 gram per deciliter. The patients saw remarkable clinical improvement following initiations of medical management include antiprotozoan, antibiotics, and antifungal. Here are the spot examinations of these patients. Uh, these three images above are MRI. In this figure, we they show the ring contrast enhancement with eccentric target signs. And as we note in here, there are three reactive data that came from the anti-HIV1 with SD, colloidal, cold, and diagnosed star. The discussion is here. The cerebral toxoplasmosis are late complications of HIV infections that mainly affects patients with CD4 T cells count below 200 per microliter. The cotrimoxazole consists of 3-methylprim plus sulfamethoxazole is the most common drug used to treat AIDS associated cerebral toxoplasmosis. And other alternative drugs used for this treatment of cerebral toxoplasmosis are clindamycin plus pyrimethamine and clarithromycin with pyrimethamine. And here are my references, the data to my presentation for the oral presentations. Uh, this is end of my presentation. Thank you very much for the attention. Thank you.